Filipinos are eating 5 times a day. So breakfast, you have snacks, and then lunch, and then snacks again, and then you have dinner, and then an extra at midnight. So it's 6 times a day. I'm Dr. Anthony Leachon. I'm an internist-cardiologist at the Manila Doctors Hospital, Manila, Philippines. Coronary artery disease is the #1 killer in the world. The other medical term used is ischemic heart disease. It's also the #1 killer in Southeast Asia as well as in the Philippines. It is caused by obstruction of the coronary arteries, the blood supply to the heart, and mainly it is caused by smoking, unhealthy diet, physical inactivity, overweight and obesity, and of course, alcohol drinking. And of course, a lot of stress, like persons with mental disorders is also included in this particular category. CAD is the #1 killer disease in the country. It's part of the non-communicable diseases, which are actually 80% of the killer disease in the country. So when you mean non-communicable disease, this would be coronary artery disease. This would be stroke secondary to hypertension. And then you have cancer. And then you have diabetes mellitus. Number 5 is chronic obstructive lung disease. And then hypertensive complications. When you mean communicable disease, which is 20% of the cases in the Philippines, this would mean your COVID, pneumonia, tuberculosis, and your HIV. And non-communicable disease would account for about 500,000 deaths every year, translated into 1,500 deaths every single day. So it's about 3 jumbo jets crashing every day without you knowing it. So it's a killer disease. It's a killer disease. Believe it or not, the NCD is actually more prevalent right now in women. Breast cancer. The #1 killer disease in the Philippines is actually breast cancer. So we've seen a lot of patients with breast cancer. And this is secondary to, aside from the genes, increasing body weight. So we call it metabolic syndrome. So after giving birth, and then Filipinos would not actually manage the spacing of kids. So every time you are pregnant, you will gain around 30 pounds. And then the next year, another 30 pounds. So at the end of 3 years, from 100 pounds, you will actually grow, let's say, to 180. And when you have metabolic syndrome or overweight or obesity, you will develop the following illnesses: diabetes, high cholesterol, hypertension, gallbladder disease, fatty liver. You might develop osteoarthritis as well, and a lot of complications. And then we need to address this. And this is the reason why women right now are having problems because of that. And then male, mainly because of tobacco and alcohol. But because women are actually sufferers because of passive smoking because of their husbands, so they're also affected as well. Right. The main symptoms are basically chest pains, chest tightness. We call it angina. Angina is defined as chest pain precipitated by effort and relieved by rest or the medication nitroglycerin. But there can be some subtle symptoms like easy fatigability and shortness of breath. And then if you have the risk factors that I mentioned before, like smoking, you're overweight and all, then you need to have a checkup with your doctor. They will do ECG, to the echo and history, so that you will confirm whether you have coronary artery disease or not. The basic test, they will run laboratory tests or blood examinations that would involve the following: a complete blood count, fasting blood sugar, glycosylated hemoglobin, your lipid profile, kidney function test, and liver function test, and of course urinalysis. Then they will do chest x-ray just to see the size of your heart or if there are other problems, and then ECG. So they might do 2D echo, an echocardiogram, or treadmill exercise test. And if you're positive on this one, they can either do a thallium scan or a coronary angiogram. So if there's a finding, they might do angioplasty, or if you have severe coronary artery disease, they might proceed to a bypass operation. The use of medications we give for patients with coronary artery disease, because they may have coexistent hypertension, or hypertensive medications, statins or fibrates for cholesterol, blood thinners like aspirin or clopidogrel. We can also give some medications to reduce the heart rate like beta blockers, and a lot more. When you have severe coronary artery disease, that would entail 2 or 3 vessels, particularly with diabetic patients. And that would also entail patients that would need more stents because it will be more expensive. So for diabetic patients and severe coronary artery disease, patients would benefit more for coronary artery bypass graft rather than stenting. So stenting or angioplasty might be better for a single or 2 vessel disease, non-diabetes. So there are certain indications for that. But Filipinos are eating 5 times a day. So breakfast, you have snacks, and then lunch, and then snacks again, and then you have dinner, and then extra at midnight. So it's 6 times a day, right? So that's crazy. So that's about 6,000 calories. Is to have a calorie deficit, you need to eat about twice a day only, and then do a lot of exercise.